Coffee, Caffeine, and Dementia Risk Trends. A large U.S. study following more than 131,000 health professionals for up to 4 decades has added weight to the discussion around coffee and cognitive health. Published in JAMA, the research found that participants who consumed higher levels of caffeinated coffee had a significantly lower risk of developing dementia compared with those who drank little or none. At the population level, the difference was substantial. The highest intake group recorded approximately 141 dementia cases per 100,000 person years, compared with 330 cases in the lowest intake group. After adjusting for a broad range of lifestyle and health variables, higher caffeinated coffee consumption was associated with a hazard ratio of 0.82 for dementia versus the lowest intake category. The strongest associations were observed within a moderate consumption range of roughly 2 to 3 cups per day. This level closely reflects prevailing consumption patterns in the U.S. and other mature coffee markets, making the findings commercially relevant without implying that higher intake automatically leads to greater benefit. Decaffeinated coffee did not show the same association. Tea demonstrated a similar, though not identical, pattern to caffeinated coffee. The absence of a comparable signal for decaf suggests that caffeine or compounds associated with it may contribute to the observed outcomes. The authors emphasize that the research is observational and cannot establish causation. Individual level effects are modest, and overall lifestyle factors remain central to dementia risk. However, the consistency across diagnosed dementia, self-reported cognitive decline, and objective cognitive testing in one cohort strengthens the credibility of the association. What the data show. The analysis draws on 2 long-running public health cohorts, the Nurses' Health Study and the Health Professionals Follow-Up Study. Participants provided dietary and health data every 2 to 4 years, enabling researchers to assess sustained patterns of consumption rather than isolated snapshots. Across the combined cohorts, higher caffeinated coffee intake was associated with lower overall dementia incidence compared with the lowest intake group. Participants also reported less subjective cognitive decline, and in one cohort performed slightly better on objective cognitive assessments. While the relative risk reduction is meaningful at a population level, the researchers caution against overstating its magnitude for individuals. For industry stakeholders, the durability of the findings is significant. Decades of follow-up, repeated dietary measurements, and consistent associations across multiple outcomes position the study as a credible reference point in ongoing discussions about coffee and long-term health. Implications for the coffee value chain. Coffee consumption remains high, with around 2/3 of Americans reporting daily intake. Specialty segments continue to expand, and both retail and workplace channels are increasingly focused on quality and experience. Within this landscape, evidence linking moderate caffeinated coffee intake with improved long-term cognitive outcomes adds a further dimension to category positioning. The findings do not justify framing coffee as a functional health product, and the researchers explicitly avoid prevention claims. However, the alignment between the strongest associations and realistic daily consumption levels reinforces the central role of habitual intake. 2 to 3 cups per day represents an achievable, routine behavior rather than an aspirational target. For B2B operators, this places greater emphasis on consistency. Reliable extraction standards, effective water quality management, robust equipment maintenance, and stable supply chains all contribute to delivering a repeatable product experience over time. As coffee becomes further embedded in long-term daily routines, operational reliability and quality control take on strategic importance. Infrastructure choices, often evaluated primarily on cost or efficiency, also underpin this consistency. Water treatment, mineral balance, and equipment protection influence both flavor stability and machine longevity. While suppliers may position these solutions in operational rather than health terms, the broader context is clear. When consumption is habitual and long-term, system-level performance matters. From a commercial perspective, the key takeaway is not that coffee prevents dementia. It does not. Rather, a large, well-designed study has identified a sustained association between moderate caffeinated coffee intake and improved cognitive outcomes over time. Such findings are likely to influence consumer perceptions and industry narratives, even when interpreted cautiously. For stakeholders across the coffee ecosystem, the longer term implication is measured but meaningful. As daily coffee consumption is increasingly viewed through a multi decade lens, quality, process control, and consistency become integral to the value proposition. The opportunity lies in aligning operational standards with a market that sees coffee not simply as a beverage, but as a durable daily habit.